Hi there, I'm Dr. John Nichols. I'm the medical director here at PREG, and today we're going to be talking about age and its effect on fertility. Now let's start with men first because this will be a little easier. One thing about men, they make sperm throughout their lifetime. Now we do know that over time men's sperm counts do go down as well as the quality of that sperm. So age for men does have some effect, but it's very much different for the age effect for women. So we're going to spend a lot more time on this issue. So it's important to understand for women, they're born with all the eggs they will ever get, and all women will run out. All women will become menopausal. When you're menopausal, you've completely run out of eggs, and obviously there's no chance for pregnancy with your own eggs. So this is an important factor because when you sort of spread out the age and its effect on pregnancy rates, what do we know? Well, peak pregnancy rates for women is going to be in the late teens to about late 20s to about age 30. And when you look at that peak number, we always like to look at it, what's that considered? So we know that the pregnancy rates for women in that age group, that younger group from late teens to late 20s, is about a 30+% chance of pregnancy each month, which doesn't sound like a big number, but in fact in infertility, that is a very good number. So 30% chance of pregnancy per month for those women in that very peak reproductive years. Now, unfortunately, after age 30, that number is going to start to drop. So by the time you hit age 35, it's going to be about a 20% rate. Get to age 40, it's about 10 to 15%, and then after 40, it drops off dramatically, dropping down by about age 45, less than a 1 to 2% rate. Because this has everything in the world to do with the fact that, again, those numbers of eggs are dropping by time, as well as the second issue is the quality of the eggs. So we got quantity, and the quality is that now eggs are 40 years old. Guess what? At age 40, they're just not as healthy an egg as they were at age 30. Because remember, the egg itself is the largest the largest cell in the body, and in that cell has all the machinery to make an embryo. And that the sperm itself, it's just a small little head with a tail, and it basically, once it fertilizes the egg, just really gives the DNA of the male. It's really a DNA transport system for the most part. The egg has all the machinery. And so when that sperm gets into the egg, it turns on the machinery so it can start forming an embryo. And this is where quality has an issue, because as that egg sits for 30, 40 years, when that machinery starts to turn on, it just doesn't do as well. So what does that mean for women as they're getting older? Well, the three things that happen as you get older: you're not getting more fertile, you're getting less. Those pregnancy rates are going down. Secondly, as you get older, your risk for miscarriage goes up. And we know that one of the most common reasons for miscarriage is that they're not normal embryos. So when that machinery doesn't work well, you have a higher risk for developing abnormal embryos. And thirdly, the risk for Down syndrome, these things, that's again a part of that embryo that's not normal, genetically not normal, and that has a lot to do with how well that egg can form a normal embryo. So age is very important for women for fertility, and this is difficult. Now what's very interesting, and you're going to hear more and more about this, is nowadays we have certain procedures we can do to help preserve eggs, because once again, a 40-year-old egg is going to be difficult to get to pregnancy. It can happen, but it can take a lot more effort, time, and treatments to get there versus a 30-year-old egg. So part of the things that are happening now is you're going to hear more about egg freezing, what we call elective egg freezing procedures. And this is where a younger woman, hopefully around age under 35, or around 30 and under 35, can come in, get stimulated like you do an in vitro fertilization cycle to make multiple eggs, and then you can take those eggs and freeze them. And then you have those eggs sort of in a bank for you that you may or may not ever need, but if you do, you will have them available for you for the future. A lot of women who are now very career-oriented are going ahead and doing elective egg freezing now to sort of preserve those eggs so that if in the future they need them, they're going to be available. And those eggs, once again, being younger and healthier, have a much better chance for pregnancy success. So it's important that age has a huge effect for women on pregnancy rates, but we also now, with fertility preservation with egg freezing, can help women sort of put that fertility in a bank, so to speak, to help them down in the future. So hopefully this is good information for you. If you have any questions about egg freezing or other things with infertility, please contact us at PREG.